Reports indicate that Uganda is registering at least 1,000 new infections of COVID-19 daily in the second wave of the deadly virus. According to doctors, the fastest way of preventing COVID-19 is by wearing a face mask, washing or sanitizing your hands regularly, avoiding the touching of your eyes, nose and ears, among other measures. The current surge is threatening to overwhelm health facilities around the country. Consequently, the Uganda Medical Association has issued preventive measures the public can use to reduce the number of fatalities. The preventive measures include the following.
Drink a lot of water. We need at least 2 to 3 liters of water or juices every day. A man needs up to 3 liters or more. A lady at least 2 liters or more. In this include fresh juices such as orange juice, lemon juice, and these juices will provide us with the vitamin C that we need.
Those who have tested positive for COVID-19 but have no signs of the disease are advised to deal with their mental health in order to avoid getting weaker.
Because the idea that I am now infected is going to stress you, you're going to have a lot of stress, and if you have a lot of stress, your immunity will go down. And if you are so stressed, please call and talk to somebody. As adults, we should sleep for at least 6 to 8 hours. Sleep is so important in resting our body and in rebuilding our immunities.
Most patients are reportedly suffering from mild symptoms of COVID-19, which include fever, sore throat, cough but without difficulty in breathing, body muscle pain, headache, and fatigue or feeling of fatigue. The medics further gave guidance for the people who have mild or severe symptoms.
Monitor your temperature at least 3 times a day. For those who may have thermometers, that will really be good so that you can measure it. Because should the temperature go beyond 38.5, you need to go to hospital. You can't stay at home with mild. It will no longer be mild disease. If you experience any difficulty in breathing, rush to hospital. This is now an emergency.
The entire public has been advised, especially for everyone, to at least sit under the sun for 30 minutes every day, especially mid-morning, because the morning sunlight is always a good source of vitamin D that helps in building body immunity. For those who are undergoing home care treatment, you've also been warned against accepting to be put on oxygen. For others who buy medicine over the counter, you've also been warned against using prescriptions that have been awash on social media.
Do not buy dexamethasone and take it at home. Do not buy prednisolone and take it at home. These things will lower your immunity. They can only be prescribed by a doctor for good reason. They may worsen your diabetes or induce new onset diabetes. Please don't do it. People are buying antibiotics over the counter. It is creating drug resistance in our environment.
Now that many children have returned back home after government closed schools to avoid further spread of COVID-19, the parents have been advised not to steam the children.
Please do not give steam inhalation for these children. You are going to burn their airways. It is going to injure, and should the diseases now come, you will have provided a clean pathway for the diseases to enter their system.
The doctors gave more guidelines to the holiday makers.
Parents, please restrain the children from moving out and playing with their neighbors.
For the learners who have just returned from school, their parents have been advised not to allow the learners interact with their grandparents. Sudhir Yarhanga, NTV.